Okay, I'm going to take a listen to your heart, okay? So people will get sicker. This will cause health problems and exacerbation of health complications for people who no longer have health care. It's devastating.
This is kind of life and death we're talking about.
Yeah, across Ontario, this is life and death.
You can see the effects of the primary care crisis all across the country, but probably the most dramatic example is about to happen here in Sault Ste. Marie, Ontario. In a town of 70,000 people, 10,000 are about to lose their family doctor.
Nobody realizes how helpless you actually feel when you realize you can't access anything without a doctor first. That's the entry level to our healthcare system.
That's Mike DePratt. He's one of the 10,000. In fact, everyone at this meeting at the local union hall will soon be derostered. That's what they call it when you lose your family doctor.
My name is Barry Armstrong. I'm 85 years old. I will be derostered at the end of May. I suspect I will never have a family doctor during my lifetime.
To me, it's creating a lot of anxiety that I don't have a doctor, and going to emergency, I've had to do that a couple of times. One was a 12-hour wait to say, could you please renew my prescription?
I may not make it if anything happens. If I have issues like I've had in the past, and if I don't have a medical issue, a medical doctor, I may not make it. Because it's going to take too long until they figure out what's wrong with me. I'll be 6 feet under.
Everyone here now struggles with those kinds of sentiments. What's going on with primary care is the biggest issue in Sault Ste. Marie today, by far. And what you need to know is that almost everyone who lives here, when they go see their family doctor, they come to this building. This is the group health center. This is the place where 10,000 people are about to lose their family doctor. Now, obviously, that is not a good news story. But when I called them, it surprised me that they were happy to talk about the situation. Dr. Jody Stewart, a family doctor herself, is the CEO of the Algoma District Medical Group. She's in charge of the physicians who work here. Why are you derostering 10,000 patients in a city of 70,000?
At this point, we don't have the manpower in terms of primary care providers to provide ongoing care to those patients.
Dr. Stewart says the reality here is no different than anywhere in the country. There's a shortage of family doctors to replace those who leave or retire. I spoke to some patients who are being derostered, and as you can imagine, they're angry, they're frustrated, they're scared.
Yeah.
And they don't blame it on the doctor shortage necessarily. They blame it on you. They blame it on the group health center. What would you say to them?
I understand their feelings. I understand being scared. I think they have every right to be scared. These 10,000 people, my family is in this 10,000 people. My kids' teachers are in this 10,000 people. Our friends are definitely in this 10,000 people. So it's not easy.
So this, for you, as a family doctor in this position, is personal?
Oh, yes, yes. This keeps me up at night. I worry about the health of this community long term. It's very personal, yeah.
It becomes clear as we talk that leaving 10,000 people without primary care is taking a toll on Dr. Stewart.
Sorry.
What is the worry?
These are the people I know. These are the people I love. And I know that without primary care, they're not going to do well. And we know, and the statistics show, that if you don't have a family doctor or good comprehensive primary care, your chronic disease won't be managed. You'll end up in emerge. You'll end up in hospital. You'll end up in long-term care. This is not what I want. This isn't what I want for my loved ones or any of the members of the community that I live in.
The news about the 10,000 has shaken Sault Ste. Marie. That's because since the 1960s, when the group health center was built, it's always been a source of pride here. The local steelworkers built it as a place for people to get their health care even before Medicare existed across Canada.
The first time that I came through the doors of the group health center here in the Sioux, I was actually a newborn being carried by my mother in a bassinet. And now, years later, decades later, I'm very proud and honored to work here as a pediatrician.
That's Dr. Jonathan Della Vedova. He's been very public about defending the group health center. He says the news about the 10,000 doesn't mean the place is broken.
What I'm worried about is that people are losing faith in this as an institution. Like the group health center, I think, is the model that the rest of the province should be following in order to rescue healthcare. I worry that the group health center, because of this large de-roster, is receiving a negative perspective amongst the population. Hi, Camila, how are you?
Dr. Della Vedova still believes in this place, and he wants to show me why it works.
Follow my finger with just your eyes, okay?
He sees 9-year-old Camilla for her diabetes.
Very good. It does look like overall the sugars are running a bit higher on average.
What's different here is if he orders blood work or any other test, she can get it done without ever leaving the building.
Changes made since last time?
She could also see another specialist. There are 80 primary care and specialist physicians who work here.
What could have been 3 or 4 different visits, we can accomplish all in one visit with all the professionals that she needs to see in the same room. Because if we can take
Dr. Della Vedova says it's more efficient this way and saves money.
your sugars will come down.
He doesn't want people in Sault Ste. Marie to forget the importance of this place. He says even after the de-rostering and with the shortage of doctors,
And trying to track
50,000 people will still continue to get their care here. How does that work, that this is supposed to be the solution, but you're de-rostering 10,000 people?
Yeah, I think one, the doctors just aren't there, right? We have family doctor graduates who are not choosing to do family medicine. We have empty family medicine residency spots because people would rather choose almost any other specialty than family medicine right now. So something has to change within the practice itself.
But in the meantime, the stark reality remains. 10,000 people are about to lose their family doctor here. Josie Tenazzo is one of them.
I'm so grateful I had such wonderful doctors. I've been so grateful all these years that I had them and I could get at them. I can call them.
Josie has been going to the group health center since she was young.
My doctor saved my life because I had a brain tumor and she realized that, and I was immediately sent to have brain surgery to have that tumor removed. And that's why I'm here today.
But on May 31st, Josie, at 79 years old, will be one of the 10,000 to lose her family doctor. What are you going to do?
Can I be very honest? I don't know. I don't know. I would have to go either to an emergency. Nobody knows my history. Thank God so far I've been okay. But who knows what happens next week, next month? I don't know.